Spain's public healthcare is free, but getting in? That's where expats get stuck. Here's what nobody tells you when you move to Spain. Yes, the public healthcare system is excellent. World-class hospitals, skilled doctors, and for residents, it's essentially free at the point of use. But there's a catch that hits a huge number of non-EU expats in their first year. It's what I call the gap year. Your visa requires private insurance, so you buy a policy from day one. But the public system? You can't just sign up on arrival. For many newcomers, there's a waiting period before you can apply for Convenio Especial, the pay-in program that can give you access to the public system if you're not working. So year one, you're paying private premiums for coverage you may barely use, while everyone tells you Spain's healthcare is free. It can feel like paying rent on 2 apartments when you can only live in one. The good news is, once you understand the routes in, the whole thing becomes predictable. There are 4 main ways expats actually get healthcare in Spain. Route 1 is employment in Spain. If you work here on a Spanish contract, you pay into Seguridad Social. That contribution is what links you to public healthcare. And here's the warning for digital nomads. If your employer is foreign, you might be living in Spain but not contributing to the Spanish system. That means you don't automatically get public coverage just because you have residency. Route 2 is autónomo, self-employed. You pay a monthly social security contribution, and that buys you into the system. Think of it as a monthly operating cost of working in Spain. Route 3 is Convenio Especial. This is the pay-in option for non-workers and retirees who don't qualify through employment. The cost depends on age, often roughly around €60 a month if you're under 65, and more if you're older. But the key point is eligibility. You generally need to be properly registered as a resident first. Route 4 is private insurance. This is where most expats start because their visa requires it. Typical premiums might run roughly €120 to €250 per month for under 65s, and more for older applicants. But not all policies are created equal, and the cheapest option is often the one that causes the most problems later. Now, once you're inside the public system, what do you actually get? Spain is genuinely excellent at serious medicine. Surgery, oncology, cardiology, emergency care. This is where the public system shines. On the Costa del Sol, places like Hospital Costa del Sol in the Marbella area and major Malaga hospitals are serious institutions. But there are gaps that surprise a lot of expats. Routine adult dental is usually not covered. Glasses and contact lenses are typically out of pocket. Mental health services exist, but wait times can be significant. This is why the hybrid approach is so common among long-term expats. Public coverage for the serious stuff and prescriptions, and private coverage for speed, dental, optical, and sometimes English access. And this is the part most people miss. Getting healthcare access in Spain isn't mainly about healthcare. It's about identity, address, and registrations. Here's the paperwork chain that unlocks everything. First, your NIE or TIE, your foreigner ID. Then Padrón, your town hall registration proving where you live. Then Social Security affiliation if you're working, or time and eligibility if you're going the Convenio route. And finally, registration with your regional health service at your assigned Centro de Salud. Your Centro de Salud is assigned by address. You don't choose. That can feel restrictive if you're used to shopping for providers, but it's how the system manages patient load. And then there's Cita Previa, the appointment system. For most non-urgent care, you need an appointment, and same-day slots aren't guaranteed. Specialist referrals can also take weeks or months in the public system. Now let's talk about private insurance, because this is where expats make expensive mistakes. Mistake number 1 is keeping your Year 1 visa policy forever. That policy was optimized to meet visa requirements, not to give you the best long-term value. Once you're settled, shop again. Mistake number 2 is assuming private means better medicine. Often, what private buys is convenience, faster appointments, a nicer room, more English-speaking staff. But for complex or serious medicine, the public hospitals can match or exceed private facilities. Mistake number 3 is ignoring the network. On the Costa del Sol, English-speaking private care is dense in the Marbella-Fuengirola corridor. Live further east toward Nerja, further west beyond Estepona, or inland, and your private network thins out fast. In Spain, geography is healthcare. That Costa del Sol healthcare geography matters more than people think. Malaga City has excellent hospitals, but public care is Spanish first. Inland towns are predominantly Spanish only. English services exist where English-speaking residents cluster. In emergencies, Spain does something that surprises many expats. They treat first and sort paperwork later. Emergency departments, urgencias, continue to treat patients. The number to remember is 112 for general emergencies and 061 for health-specific emergencies. And day-to-day, Spanish pharmacies are one of the best parts of the system. They're everywhere. Pharmacists are practical and helpful, and with public coverage, many prescriptions are subsidized. You pay a portion at the counter rather than full retail. So what's the bottom line for expats in 2026? In your first year, you'll likely need private insurance for your visa. Budget roughly 120 to 250 euros monthly, and shop based on network coverage, not just brand names. Long-term, aim for public access via Social Security contributions or Convenio Especial. It's usually cheaper and gives you continuity. And for many expats, the hybrid approach works best. Public for serious care and prescriptions, private for speed, dental, optical, and English access when you need it. Spain's healthcare delivers excellent medicine. The friction is in the access layer, the paperwork, the waiting periods, and the language barriers. Once you're inside, it works. If you're navigating healthcare in Spain, subscribe at waypointsur.com. We publish practical guides every week for expats living on the Costa del Sol. The stuff your gestoria should have told you.